serve a God who is still inviting and calling individuals to repent and turn away from their dark and sinful ways before it is too late. Let me get up close and personal with someone out there. You've heard sermons after sermons. You've heard appeals after appeals. You have heard the stirring message of hope preached from January all the way down to December. And still, the excuses, they keep coming. The excuses, they keep coming. You think that you're telling the elder an excuse. You think that you're giving the pastor an excuse. You think that you're giving your brother, your sister, your aunt, your uncle an excuse as to why you have not opened, read, and actively respond to the calling of God. But I say to you, the one who you are giving an excuse to is God in heaven, and this excuse, it doesn't fly. I say to you that God is waiting for you to respond positively to that invitation. But if you want to do things the hard way, it can be done. No, Pastor isn't threatening anyone here today, but I say to you that the choice is yours. The ball is in your court as to whether or not you do things the easier way or the harder way. You can make an active decision to commit to following the Lord out there. You can make an active decision to commit to following the Lord all the way. That the Lord has rested heavily on your heart, that you need to accept him. You need to follow him. And sure enough, you need to go all the way in baptism, but still you're being a bit stubborn. I want to say to you that God has sent somebody a direct message in the comfort and the confines of their space this day. I don't know what your name is, but the Lord has sent you a direct message. And the message is clear, pointed, and possibly quite troubling, but God knows what he is about. You may have a fiery temper like Katharina. You may have a magnanimous pride like King Nebuchadnezzar, but God is saying, come nonetheless. God is saying, come nonetheless and serve him with all your heart. God is saying it does not take the chopping down of a tree, but if that's what it takes for you to surrender your all to him, he loves you enough to do just that, so that the distance that you have created between yourself and the loving Savior can be bridged. I say to someone out there, give God a chance to do all that he says that he wants to do in your life. I say to someone out there, people need the Lord. Some recognize it, some don't recognize it. But whether you recognize it, yea or nay, people still need the Lord, and the Lord is available today. The Lord is available right now. And so I want for you to listen to these very specific instructions. If some way, somehow, this message has touched your heart, if some way, somehow you recognize that you have been playing hide and seek with God, I say to you that a link will be provided right now in the live chat. And if you don't want to go into the live chat, you can check the descriptions of this video and click that link. Yes, there are options there. You may need prayer right now in this moment. You may recognize that, hey, I don't want to put this off any longer. You can choose that option as well. And you may be saying to yourself, I want just yet another Bible study session. You can check that option as well. But what I say to you, in the name of Jesus, make a decision to make your calling and your election sure this evening. For you don't want to go through an episode of the taming of the shrew. You don't have to be a shrew. The Lord wants you to be a precious son and a precious daughter of his, looking forward to his soon appearing to take us home to spend eternity with him.
Just as I am without one plea,
Since 1962, we've proudly charted our course. But did you know Jamaica's head of state is still the British monarch? That means officially our highest constitutional authority is not Jamaican. Becoming a republic is the next step in deepening Jamaica's constitutional sovereignty. It means replacing the British monarch with a Jamaican president as head of state. In 2024, the Republic Bill was tabled in Parliament, a major move in the reform process of the Jamaican Constitution. The process will take place in 3 phases. Right now, we're in phase 1, replacing the monarchy and laying the foundation for a republic. But this change needs your approval through a national referendum. This is not about politics, it's about pride, about a constitution that finally looks and sounds like us. It's about our legacy, our identity, and our future. Join the journey, get informed, ask questions, and when the time comes, let your voice be heard. One people, one republic, one Jamaica.
Getting the keys to your own home is a feeling many cannot describe. It's a moment we all hope for and a dream that all Jamaicans have. The new social housing program is the difference between a dream and reality. The government, through the Ministry of Economic Growth and Job Creation, is building hope, one home at a time.
I wonder who that somebody be. No, sir. Let me look for my glasses. Oh, that somebody look like Roy, sir.
It's Lottie, walk on.
Me glad for see you, Roy. Although things never go on for you, America, me glad say you there.
Yes.
Lift your head high.
Yes.
Stay out of trouble.
Yes.
And you can have a fresh start back home.
All right, Mr. D. Thanks, you hear?
Let's all work together for a fresh start back home.
The following is brought to you by the Office of the Prime Minister.
Jamaica is your homeland. You are not homeless or stateless. What we are trying to build here is a place where every Jamaican can feel proud and comfortable to come back home. That's what we want to build here, your homeland. And if you're finding it difficult where you are, come back here. Ackee and saltfish was always good. It's on the tree, you can get it. Don't stay there and suffer. Come back home. But as I said before, don't come back here to destroy your homeland and what we have been working very hard to create so that you wouldn't have had to leave in the first place. And as I said, we have been making strides in that regard. So expect to be dealt with a firm hand if your intent is criminal. Come back and let us build your homeland so that you can stand up with pride with the citizens of the world about your country. That you don't have to be economic refugees. That's what it is about. Disabuse yourself of this notion that you can only make it through crime and therefore you're going to join a gang and become a part of the problem. I appeal to all of you who have been exposed overseas and see what prosperity is like. Come back home and let us work together to build the prosperous nation that Jamaica is destined to be.
I love cars, but your cars go fast. If they go too fast, they might not see us. I love to run and play. Please watch out for us. You can keep us safe. Just drive slowly.
What is the role of a backbencher in government? I'm glad you asked. They're members of parliament who are not appointed to cabinet. So they sit in the back of the legislature and they apply pressure. They examine what government legislates, participate in parliament debates, raise issues and advocate and question chamber when things don't look straight. Backbenchers represent the constituents in parliament. Backbenchers oversee the interests of citizens, you and me. But how can they be agents of government accountability after them no hold no portfolio? And them and a minister? No. So then how can they facilitate government transparency. And the next thing, them on a front bencher. So how them affect me? You see, a lot of work is in committees. So these portfolio-free MPs with less dire responsibilities.
Hurricane Melissa. Beside Mr. Stein is Kadian Birch, who is our acting permanent secretary. To my right immediate is Dr. Dawkins Wright, and she has been helping to marshal the response at the Emergency Operating Center, and our PR rep next door to Dr. Dawkins Wright, Ms. Watkis, my apologies. There are other persons in the room representing different arms of the health portfolio, environmental health, epidemiology, and other areas of the emergency response. So this might take a little time, but I crave your patience. Just would like to say that up to this point, we have been responding via the social media primarily, and some releases going out in a way that is not reflective of perfect information because of the nature of the crisis that we face, and have been coordinating our response, of course, via the cabinet led by the Honorable Prime Minister and other colleague ministers who are marshalling different aspects of the response. In a sense, this is our first relatively comprehensive response. And I say so in the context that in the last 2 days, 2+ days, I spent the time actually going in the field, in some instances by air, going into Black River, and then from there by air to Cornwall Regional, and then by road, maneuvering the roads to Noel Homes and to Sablamar Hospital and Sablamar the town, and then working my way back to Falmouth and then to St. Anne's Bay. So information was a bit, communication was a bit choppy during that period. We have been able now to put in communication at these institutions. So it was very difficult sometimes to communicate and to keep the country updated. And we have tried the best we could given the circumstances, but I think we're now in a position to give a better update generally. The first thing I'd like to say is that the corridor from St. Elizabeth through to Westmoreland, Hanover, St. James, and Trelawney have been impacted significantly by the storm, by the hurricane. In terms of health services, now I'm referring to health services. Clearly, Jamaicans living in that corridor have all been impacted in one way, shape, or form. But from a health services perspective, so I wanted to begin by firstly, not just speaking as a health minister, but as a Jamaican, having seen it myself, to express our sympathies, our support to Jamaicans, thousands of whom have been impacted, some very significantly, whether it's property or life or limb, and who are struggling now just to cope. It is a real tragedy for them and for the rest of us, and certainly for the health team. We want to just identify with them and to provide as much support as we can. The second point I want to make is that health workers have been victims of this tragedy also. Those health workers living along that corridor, some of them had to man their stations, not knowing what was happening to their homes, to their loved ones. When I went to some of the locations, Noel Homes, Sav, there were some there for 2 and 3 days, and they weren't sure exactly what happened to their own possession, their home and their family and loved ones. So it is a real difficult time for the health staff. They're in a slightly unique position. All are suffering, obviously, but their job it is to save lives and to provide, to be there on the front line. And the extremity of illness and injury and trauma makes them absolutely essential, and they have been doing so sometimes without information on their own circumstances. So I really want to just reach out to them and just recognize them and just to say that our prayers are with them, our support is with them. And, they have really been critical to the response in the immediate aftermath of the storm. The updates that I will give is based on some that I have seen myself and reports that have come in here to the Emergency Operating Center, headed by the team that is to my right and left. And so we have combined the updates to try and give as best information as possible, because we know information in this time is very critical. I want to start with hospitals. So you would have seen that all these hospitals in the corridor would have been impacted, with the Black River Hospital in St. Elizabeth being the most severe, and that facility essentially will have to be, for now, totally relocated in terms of services, and I'll give more details on that shortly. But the roof damage, the seawall, the administrative wing, the ward space, the operating theater, right across the stretch, Black River Hospital would have been significantly damaged. The Savlamar Hospital in Westmoreland, also very damaged, roof damage. The outpatient clinic was totally demolished. That was previously a COVID ward. That's on the compound, the health center across the street from there. Roof damage. And of course, with the roof damage, the contents within the building would have been impacted significantly from water damage. So the diagnostic equipment and other such very vital pieces of equipment would have been impacted. And Westmoreland was really hit hard, and both the roads leading into Westmoreland from St. Elizabeth, which are still blocked, which I know the NWA and the JDF is working to restore. We had to travel via the Negril coastline back into Sav, and those roads are partially blocked, but we maneuvered. But the off-roads from the main roads would have been hard to reach those communities, and some of the staff members would have been marooned in, and those at work were having difficulties accessing their family members. So Savlamar also very damaged. Falmouth Hospital, significant roof damage. The A&E, maternity, dietary, the health center, the additional block that was built for COVID, all sustained significant roof damage. And as a consequence, they've had to use one small area for patients and for giving support. Noel Home, similarly, the wards, dietary, A&E is intact, that section. The nurses and doctors' quarters, the health center on the compound, all sustained significant roof damage, and by extension, the internals of those buildings would have been flooded out, which creates a lot of problems. And similarly, staff access in and out have been a real challenge. And then Cornwall Regional Hospital, the damage was significant to the areas that were built to expand ward services for as a expansion for what would have been the gaps created from the repairs to the main building. The two new buildings, Western Child and the renovation at the main Cornwall building, sustained some damage, but nowhere as severe as the previously nurses and doctors' quarters, which essentially was the hospital, housing the hospital. The A&E, which was the original Mount Salem clinic, roof damage significant, and the staff had to be housed, and the A&E operations in the diagnostic center, which was built next door to the Mount Salem Clinic, now the A&E. So essentially, those 1, 2, 3, 4, 5 hospitals have sustained significant roof damage and flooding. And the doctors and the staff, nurses, have had to be makeshifting their arrangements to try and cater to both inpatient but emergency care. I want to mention Mandeville and St. Anne's Bay Hospital, not because they sustained significant damages, but because they have had to manage some of the spillover of patients. In the case of Mandeville, patients from St. Elizabeth, we've had to relocate patients out of Black River. And so they've had to take the additional capacity. In the case of St. Anne's Bay, where I visited, they are seeing maybe 60% more patients in A&E because persons are coming out of Trelawney and even as far as St. James to access health services because of the challenges being faced by those affected institutions. So I want to recognize the staff at Mandeville and St. Anne's Bay. While St. Anne's Bay had some damage, it was nowhere near anywhere else, the others, and they have had to be working. So the team have been trying to manage the new context in which they are forced to reside. So having given that outline, I want to focus on the solutions because I think, we are resilient people and the health system has to be there to give the support to the population and in their greatest need. Even with the challenges of the staff, we have to make do and ensure that we are up and running. So this is the work that has gone so far into trying to solve some of the issues, at least in the short term, with immediate, medium, and longer term solutions to come. The immediate challenge of the impacted hospitals is to preserve the accident and emergency services. What we're seeing is that a lot of people are coming in now to these facilities with trauma related to falls from the roof, from ladders, nails penetrating their feet, other objects, getting cut. They're really trying to pick up at the pieces, and in doing so, it's creating some accidents. This is beyond the extreme situation of deaths that have been discovered and are being retrieved, unfortunately and tragically. So the A&E is where the absolute priority is, and so there are a couple of things that are required for A&E to function. First of all, the staff, and we're reaching out to the staff to give them some support so that their own welfare, even with the inconveniences, can be addressed. But we need water and we need electricity in the first instance. So I can report that we have made arrangements. These institutions have backup generators. There's no electricity. We have made arrangements for ongoing supply of fuel for the generators, and that is in place. And so the electricity on the compound is, in the first instance, supporting the accident and emergency functions and the supporting services for accident and emergency to function. That would be the lab services, the diagnostic services, to the extent that those equipments are functional. And that's the instruction, and that's the work that the team on the ground are actually working on. The other is communication. We had serious communication issues. We have now put in place the satellite phones, Starlink, I think they're called, at each of those locations so we can communicate. Previous to a day ago, it was difficult to get information in and out of those locations. So we've made the arrangements to put that in place. The other is water. And we've worked with the NWC, Minister Samuda, and others to ensure that the institutions get a daily supply of water. Water is critical, as you know, for infection prevention and control, for treatment, for dialysis, and so on. So those are the basic minimum. In addition to that, trying to ensure that there is a covered space, because some of those areas actually are exposed to the elements. So if it rains, then clearly it compromises the service provision. So I'm relatively pleased with the approach to getting A&E back up and functional. It's not comfortable. It's not ideal. There is still some crowding, and even more so now, because people are coming in, particularly in some of the institutions where the space is crammed. But there is functionality. And the heroes of healthcare, or doctors and nurses in that space, are there and are providing critical support. The welfare component of food supplies is also another critical component, because to the extent that we have inpatient care, which is the second priority, having some bed space capacity in those institutions. In Noel Homes, for example, that bed space is placed in the corridors that are covered because the ward space are exposed. And I could say, in terms of the other institutions, Cornwall Regional, Falmouth, and even SAV, some of the ward space is exposed, so they've had to make do. And the management on the ground is asked to ensure that we at least have some minimum capacity for ward space, primarily dealing with accident and emergency. So for those 5 parishes and hospitals, accident and emergency, trauma cases are the priority, because it's really about saving lives. And that's what the team on the ground are doing. In terms of primary care, there's an assessment that is now being done for the health centers, and we are still yet to get the full details on that. But to the extent that a primary healthcare facility is close to a hospital within those 5 parishes, at SAV, the health center is on the compound, the outpatient, and across the street at Noel Homes on the compound. Where they have been damaged, we're trying to restore them to at least a level where we can triage the non-emergency cases into those health centers and try to staff those to provide other types of care for persons who may be chronically ill or have a case that doesn't require accident and emergency attention, but nevertheless requires attention. And in the coming days, we will try to complete that process so that those Jamaicans who may need to get their checkup because they have diabetes, arthritis, those kind of chronic illnesses can be given the attention at a site that is close enough to the hospital while we complete opening up and assessing those health centers across the country that may have been impacted. It is our intention over the next week to resume activities in all our primary healthcare facilities. And that has started. It will continue as we go along. Some will require generator capacity because the electricity is down, water storage, but we had made provisions in a number of these to ensure that these are in place. Where they are not, we're going to try and put them in place so that we can restore some normality to community health. So that is an ongoing effort that is now taking place. I want to just go back to hospital care and focus on Black River and generally on field hospitals. So we have been working in the last few days, both health along with other agencies and ministers and ministries, foreign affairs and others, to secure a number of field hospitals. Our PAHO rep is here and he probably can elaborate later on, but just to say that we have been able to secure one field hospital that is to be delivered over the next 24 hours, all other things being equal, to Black River, which we have done our reconnaissance and identified a site The team visited yesterday, was it? We're coordinating with the JDF and other agencies of government, and that field hospital is expected to be delivered sometime tomorrow, and immediately we'll begin to deploy and to set up that facility. That facility will come fully equipped, which will include an operating theater and other critical diagnostic equipment, and some team members to support the local team. And therefore, we're hoping that during the course of this week, St. Elizabeth, the parish, and Black River, the capital, will have a functional hospital, which is a field hospital, while we assess what is happening at the original hospital. And hopefully that will bring some level of comfort and support, despite all the other challenges, to the people of St. Elizabeth and Black River. The team we're working with is called Samaritan's Purse, which is an NGO that will be working to set that one up starting tomorrow, Sunday. We are also looking at field hospital support in conjunction with the Pan American Health and other governments. We have a field hospital that is coming in from Spain and the Spanish government, and we are now doing an assessment at Sablamar and Falmouth, looking at where is best suited to locate that facility. Similarly, so there are discussions with the Canadian government and the Indian government, and we are working on the assumption that we will see another 2, possibly 3 field hospitals. So the intention is to locate a field hospital starting with Black River tomorrow into the coming week, Westmoreland, that's Sablamar, Noel Holmes, Cornwall Regional for some additional support, and Falmouth, that's in Trelawney. The field hospital is a fully equipped facility, so it comes with all the necessary gadgets of diagnostics and treatment, bed space, and therefore it will add for us significant capacity, both from the standpoint of the infrastructure damages that we have in those parishes, but also the personnel, because we have to bear in mind that our people, our health workers, are also traumatized and they need some support in the field. And so we're hoping that in the next few weeks, starting tomorrow, some capacity will be added through the field hospital deployment, and the team is working on the ground so to do. While we're doing that, a team has gone out already working through the NHF to do an assessment of the hospitals that have been damaged, and the intention is to quickly come up with a solution to bring back services within the main buildings, starting with the priority areas. So yesterday we had a helicopter with quantity surveyors that has flown through the critical parishes, and I'm hoping to get a report on what needs to be done to restore those facilities, at least get a costing for those facilities to be restored. Tomorrow, Sunday, the health workers who have not been impacted by this storm in the 5 parishes, have grouped together to go to the 5 hospitals for a cleanup, expressing solidarity and support to our healthcare workers and others on location in these 5 locations. So we have about 200 or so health staff. We're working with health staff in the first instance. We know there are others who want to volunteer. We'll be leaving Kingston early morning, I think 6 a.m., supported by the JUTC, and we will be visiting maybe a team at Black River, primarily focused on the field hospital setup, JDF-led team. We'll be going to Falmouth, Noel Holmes, Cornwall Regional, and SAV. a team of at least 30 or 40 per location. They'll be going in, helping to clean up on the compound of the hospitals, giving support to the local team, maybe some welfare support, working with the Ministry of Labour, and basically humanitarian support for our colleagues. What we have to recognize is that there are parts of the country that, if we are not careful, can be far removed from the disaster that is taking place on the other parts of the country. Having gone there and come back to Kingston, Kingston is unscathed despite the challenges that we have. In those areas, people are actually really suffering. And we thought within our own team here that those who have not suffered the misfortune should go out and give support to those who have. And I'll certainly be out there, and a number of others will be out there. So tomorrow we have a cleanup day at the hospitals, and this will continue as we go along. We will take some food and water and other types of support. We'll all put on our gloves and help to pick up the pieces and just to give support in the field. So it's our solidarity cleanup event tomorrow across those 5 parishes. In terms of appeals, we want to make an appeal around blood. Accident and emergency trauma cases is a big issue now, and we have to give support. We have launched a blood drive, and those who are wishing to donate can visit the National Chest Hospital, Spanish Town Hospital, between the hours of 9 a.m. and 3 p.m., the Mandeville Regional Hospital between 9 a.m. and 4 p.m., and they just need to come, take an ID, and the team will work with them. But we are making a special appeal for blood, because in those parishes where persons have been traumatized or are trying to help themselves and getting into accidents, we do need supplies of blood and other supplies to support them. So I make that appeal, and we have the systems in place to do that. And I've asked the Minister of State, Crystal Lee, to help to drive the ongoing blood collection to give support for those who need it. I want to comment briefly on other areas of response, having done our assessment. Food safety. During this period, when we have no electricity, the probability of food contamination and food poisoning is greatly increased. Refrigeration, which is non-existent in these areas, meat kinds and other types of foods may be contaminated either by not being refrigerated or by rodents and other such insects or otherwise that could spread diseases. So the team I've met with the team, the environmental health team. They have an army of about 600 environmental health workers. We have increased those numbers through compensation review significantly. I'm told that just about 400 of them are currently online, meaning we are able to get in touch with them. Another 200, I believe, would have been affected by the storm and are preoccupied trying to get themselves back up. We have to understand that. But starting Monday, the 400 plus, and as we account for others, will be in the field inspecting food establishments and really protecting the consumers, protecting all of us. Already we have had to condemn some foods that have been assessed in the chain, and I know it's a difficult time, and I know food is precious, but it can be quite dangerous to consume contaminated food or spoiled food. And so I'm making an appeal to the public, work with our public health inspectors who come into the field, who will be there essentially giving good advice, giving you support in your time of need, in your time of crisis, but also protecting you from the possibility of food poisoning, because that is real. And the consequences of this can be extreme, including death. So it's very important that we recognize that. So I just want to raise that We will be using town criers and other communication devices in communities where there's no electricity, because chances are in some of these parishes many persons are offline, so they're not hearing us talking about these issues now. And so we're going to be engaging other devices so to do. But I just want to make that known. The same applies to water and water quality. Contaminated water and waterborne diseases can be equally dangerous at this time. And so the team will spend some time out there. So I want to just urge persons, to the extent that they are hearing, please discard spoiled food or food exposed to floodwaters, perishable items that were not properly refrigerated, suspicious meats or animals slaughtered to your local public health department or nearest police station. Bring the alertness or awareness and allow for some inspection, at least, to ensure that we are safe. The public health inspectors will also work closely with farmers, with butcher shops, with supermarkets, wholesalers, and all of the different establishments to ensure that we provide that protection. The issue of water, similarly, we will be issuing public advisories on water treatment, safe consumption practices, chlorine residual and turbidity testing across the country. We're going to be doing that. The public health inspectors, they'll be focusing on emergency shelters, hospitals, and public health facilities, schools, and to ensure that the safety standards are met, because, again, waterborne diseases can be a very dangerous issue. We are working with NWC, retrucking of water, and to ensuring that those, we preserve the integrity of the food chain, both for food and water, to ensure the challenges that we face. Now, just to say that in these times, diseases like leptospirosis and related ailments are frequent. Rats tend to move from the field where they are dry and now wet into places where they can find some warmth, and that's normally in people's homes. And those diseases can be more frequent in these times. So again, we ask persons to manage that process carefully. The inspectors will also, public health inspectors, conducting sanitation assessment in shelters and affected communities, as I said earlier, looking to ensure that solid waste are disposed of appropriately, again, because it's a vulnerable time. I want to turn to vector control, which is a big issue during these times. With all the rain and the water, in days, you're going to have a massive increase in the population of mosquitoes across the country. So we do anticipate not just mosquitoes, but flies, rats also. And as a consequence, we will be taking the necessary steps to be out in the field to manage the expansion of that population. We will be engaging some 413 temporary workers, vector workers. We have some 498 permanent staff and 260 already on the ground, temporary workers on the ground. So in a few days, starting this coming week, you will see, I would say, maybe close to 1,000 workers between permanent and temporary vector workers. They'll be deployed throughout the country in communities to the extent that they can move through communities, treating water storage facilities, drums, giving advice. The fogging will be picked up also in those communities. We'll be engaging some private contractors in a number of the communities. But we would want to encourage the public where you can. I know it's difficult in the 5 parishes, but the rains were right across the country, so we anticipate that the entire country will be impacted. Get your mosquito repellent, manage your immediate surroundings to the extent that you can under the difficult circumstances in terms of covering water storage containers and securing solid waste carefully to discourage water being stored and mosquitoes breeding sites being developed. But we do anticipate an increase in the mosquito population, the possibility of the Aedes aegypti mosquito and dengue threat, and so we intend to deploy our full army of persons out in the field. And you can expect that to be taking place in communities across the country. Where we need to move some of our workers, public health inspectors and vector workers across border into communities where those staff members have been impacted, we intend to do that also. So I've asked the team to look at how we can move some workers from St. Anne into Trelawney, for example, or St. James into Hanover, or Sav and St. Elizabeth, from Manchester into St. Elizabeth, because we do anticipate that some of the staff members are going to be impacted by the challenges that they face in those communities because they have been impacted by the storm. I want to just mention briefly on the mental health challenges of the trauma that we have all suffered, and those in particular in the 5 parishes. When I went to St. Elizabeth and from there to the other parishes, there is no doubt in my mind that the population that have lost their possession in St. Elizabeth, in Sablamar, Westmoreland, roofs gone, personal property destroyed by flooding, and in some instances even lives lost. There's an eerie feeling of persons just being very lost and, in a sense, in a daze as to what would become of them, their possession, their loved ones, how would they get through this process? And it is a depressing sight to see. And even though I consider myself very fortunate not to have experienced it, and for those of us in Kingston, it's hard to fully grasp the impact on the psychological state of those individuals. And it really is going to be incumbent on us as a nation to reach out and to respond, and I think a lot of us are. But from the public health perspective, we are going to have to mount a fairly assertive challenge, task to give support, give psychosocial support, give comfort, just helping those Jamaicans who have been impacted by this storm and are still trying to come to terms with it. It's going to have a major impact on the mental health of those affected populations, and those 5 parishes in particular. So the intention is to mount in those parishes a central hub, perhaps in and around where those field hospitals will be located, with a team that will develop and expand over time to do community outreach and give support to Jamaicans who really need someone to talk to, who may need just some coping mechanisms. And it's going to have to be an all of society, all of community approach, where we reach out to the community leaders who themselves may be victims, where we bring persons in to give additional support. But the mental health response is going to be a very critical part of our focus in the weeks and indeed the months to come. I want to say that we are collaborating with the Pan American Health Organization. There is an expert that is expected in the island on Monday. We intend to have a discussion on Monday, day after tomorrow, as to the national outreach and how that will be framed and how that will be managed and how we will include our own people to drive it, but also complement that with additional teams that are going to want to come in to assist, who have the credentials, the expertise, and indeed the guidance from entities like PAHO, Pan American Health, WHO. So I just want to reassure the public that health is aware of the mental health impact, the psychosocial impact on those who have been impacted, and that there is a very deliberate approach to be responding to that in the days to come and the weeks to come. The same applies to our staff members. We do appreciate and understand that the staff is also suffering from that level of mental anguish, those who are on the front line and those in those particular parishes. And part of that response is going to be staff welfare, staff support, and there's a plan that is now being developed to give support. We do have a blueprint coming out of the COVID experience. We will refine that and see how best we can add to that. But our frontline workers are going to be key to those efforts. I want to give a almost closing off summary to say that we appreciate those who have reached out and offered support. And I'm speaking about health. We know that many agencies, some external to Jamaica, persons internal, have offered support. We have put a mechanism in place. Obviously, the lead on that is the Office of Disaster Preparedness, chaired by Minister Mackenzie. Obviously, the Prime Minister, who has overall responsibility. There's a subcommittee of cabinet that is coordinating the relief efforts. Health is a member of that committee. What is going to be important for us is to coordinate the management of the response so that the impact on the ground is felt and we are not operating in a way that is not properly coordinated and communicated. And so we're very mindful around how we bring that help in to ensure that it is channeled through the right mechanisms, but efficiently so that those who are volunteering, and I've had many offers, we want to use the next few days, the next week, given that we have now gone through and seen what's on the ground, established communication, put things in place, pool that team of effort, and channel them in the right direction so that we get the best impact on the ground. Otherwise, you could get into a confusing state and chaotic and more chaotic. And we want to make sure the help goes where it is needed most. So we are part of a bigger government apparatus, but we have within health a team that is coordinating that. I have assigned a team that will meet daily, separate and apart from the emergency response team here at the center. They will coordinate with the bigger team of government on the health contributions, how it is stored, how it is accounted for, how it is allocated. The PAHO and the field hospitals, we're going to depend on them. They have the most experience in disaster response all over the world, WHO. And so we'll depend on Ian and his team to give some advice there. And there are some medical groups that have come into the country or are expressing an interest in coming into the country. I met with a few yesterday. Some are going to be deployed to assist in the primary care outreach. Others may be on the specifics of mental health, psychosocial support outreach. Others will be within the field hospitals to provide emergency care or chronic care because they are credentialed and they will take some of the burden off the staff in the affected areas. So hopefully over the course of this week, we will see a better or an improved coordination approach to dealing with that. And I just want to say to those who are anxious, we appreciate the expressions of interest. We appreciate the willingness to help and keep offering. We're not turning anybody back. What we want to do is just to channel it in the right direction based on the team that's going to be coordinating that. I, as minister, will be guiding the process by policy giving support where necessary, and of course directing back into cabinet and the larger government exactly what we're doing. Our intention, first and foremost, is to save lives. In the first instance, those who are threatened, life, we have to prioritize those, which is why A&E is so important. Beyond that, it is to improve person's condition, their wellness and well-being, treating those chronically ill, giving mental health support, restoring the critical institutions where they can depend on to get that support, and just ensuring that the community is protected, whether through the food chain, water distribution, or otherwise. And we will work with other agencies, other partners, NGOs, the entire society, the private sector, to get that job done. And that's the intention. I know I've been very long-winded, but this is the first comprehensive press brief that we have had. I really took the time to try and understand what was happening on the ground and went on the ground myself. The team has always been here, and I want to commend them, the team around the table here, for the work that they have been doing. They have been very busy, and they have been constant, even with the lack of information. And I want to just express my full confidence and appreciation to them for their efforts. But I think we're in a position now where we can more deliberately focus on the solutions in the short, the medium, and the longer term, and hopefully play our part in getting Jamaicans to restore the normality that they all crave and desire and deserve. Thank you very much. I don't know if anybody wants to add to what I've said. Ian, you want to say anything? Yeah, please. So Ian Stein from PAHO, please.
Thank you very much, Minister. And first and foremost, allow me to, on behalf of the World Health Organization, the Pan American Health Organization, as well as the whole international community, United Nations family, express our sympathy and empathy and solidarity with you as we confront this very difficult situation. As you mentioned, the first efforts are about saving and preserving lives. And in this respect, we appreciate the collaboration that you've had in advancing the setting back up of health systems, because that is where it takes place as we mobilize the necessary emergency medical teams that you refer to provide the immediate support to persons that they need to both respond to the emergencies that have arisen, as well as the normal routine process of keeping people healthy on a day-to-day basis. So the tremendous work and collaboration with our emergency medical teams is underway. There is a well-established network of pre-approved, ready-to-deploy emergency medical teams around the world, both government and in non-government organizations, and we're pleased to see that many of those have mobilized. I was just off the phone just before we started this press conference with the focal point for the Samaritan Purse. They, as you mentioned, they actually already have an advanced team of medical practitioners in Black River today, providing just the immediate support on a small team of doctors and nurses. Their team is traveling tomorrow. We'll be setting up. We expect late in the day they would expect to arrive in Black River, given the challenges of access to the road. We are meeting later today with the government of Spain to determine how to address the logistics that they will need as their cargo arrives later on Wednesday of this week. As people may not be familiar, allow me to just mention that when this type of assistance arrives, we're basically building a hospital at the time if necessary. So as you mentioned, these are fully equipped operating theaters, imaging, emergency services, and it comes with the necessary teams to support the Ministry of Health and Wellness's colleagues that are in the public health system. We are also working with you, as you mentioned, with the range of other international partners because the offer is tremendous and the needs are tremendous. Allow me to also mention that in addition to emergency medical teams that set up hospitals, it's important to consider reinforcing the public health system and primary health care, because primary health care is where people access their health services most closely. So in addition to emergency medical teams that set up hospitals, allow us to also make the offer to reestablish, with support from international the community, emergency medical teams that actually set up health centers, not hospitals, but centers, so that people can have access, knowing the breadth of challenges that are there. Allow me to mention, of course, that at the direction of my director, Dr. Jarvis Barbosa, we've mobilized our strategic reserve, which is based in Panama, and there are 5 tons of emergency supplies that are on its way to Jamaica as well. In addition, the WHO, the World Health Organization's emergency hub, I believe in Dubai, is also waiting to hear from us to see what needs to be mobilized from the broader area outside of the Americas. I would also add that we have some emergency pieces, emergency equipment and supplies that were based in Barbados. Those are arriving with the support of the Navy of the Netherlands. Those are also coordinated with the Ministry of Health and Wellness and are arriving in the coming days. You had mentioned really some critical public health messages and themes. In particular, allow me to address this really critical piece around mental health and psychosocial support. You and I, together with the Prime Minister, were in Black River on a Wednesday, and we had several hours to be able to talk to healthcare workers and people in the community, and we know that the situation is, as we know, it's traumatic. Across the island, we felt some of the impacts of the storm, but what they felt in the ground zero as it moved from Black River all the way up through Montego Bay was a tremendous burden on the resilience of any individual. And so we are working with you. Our expert will meet with you Monday, to ensure that the coordination function is ensuring that this type of support is meeting the standard. We know that there is a tremendous amount of generosity from many different organizations with a tremendous amount of depth of expertise in this area, but we appreciate the leadership of the Ministry of Health and Wellness in this area to make sure that we have a coordinated, consistent approach to providing support on this dire situation. Additionally, we have experts on the ground already to reinforce the Ministry of Health and Wellness's efforts to guide the damage assessment, whether it's the infrastructure and the important components around water and sanitation in health centers. As you will recall, when we were together on Wednesday at Cornwall Regional Hospital, the circumstances that are in the health center, that as an example, but we know across the island as well, we know that water and sanitation is the core of a health center. Without that, it's exceptionally difficult to provide safe and secure health services to colleagues as they arrive, to friends and families as they arrive. We also understand that this issue of coordination that you had just finished with is really the most complicated and probably one of the most important features after we address saving and preserving lives. Because there's a tremendous amount of generosity from around the world, the international community as well, that want to lean in to provide support to the people of Jamaica. The health cluster system, which is an internationally recognized system that is established in the response of an emergency like this, is the mechanism that we are working with you to make sure that we have the coordination in the health sector. That is a co-lead between the Ministry of Health, yourself, as well as WHO in this case. And we look forward to trying to bring order to this, because that is one of the biggest challenges. Really, certainly in this case, we have to meet the demand, but we have to meet it with an organized approach. We really do appreciate these other comments that you've made. I would share with you that I am a long-term blood donor here in Jamaica, and in the coming days I will make sure that I also go to the Chest Hospital to make my own personal donation and encourage persons, friends and family across the island. In a moment such as this, blood supply is always a very, very important, critical piece to provide support to people as they routinely access the health system for urgent care. You had mentioned this issue of food safety. I appreciate you underscoring this issue. Just yesterday, I believe, my colleague in country here, who's an expert on disease surveillance and control, was reinforcing the messaging and the expertise around leptospirosis to make sure that we're addressing this from the critical technical standard that we need to be aware and maintaining the necessary surveillance to see if there are any outbreaks that might emerge. I would also mention that on a human scale, I will be joining the Ministry of Health and Wellness tomorrow in the hospital cleanup. My wife will be joining us as well. My colleagues and friends are joining this effort because this is not only a health sector crisis, but we have to reach into our personal lives and be able to share that. So I will share that within the international community as well. At the end of the day, I want to assure you, Minister, and people of Jamaica, that the international community is leaning into this response. The collaboration with other UN agencies, in particular the World Food Programme and UNICEF, the United Nations Fund for Population Activities, UN Women. There's a tremendous amount of leaning in to provide meaningful support to make sure it reaches the people of Jamaica. Thank you very much, Minister.
Thank you very much, Ian, and thanks again for your partnership and for your support and the coordinating role. You have echoed the sentiments as outlined earlier that we have to ensure that we manage and coordinate the response in a way to get the most efficient impact, and that's very, very important. So we appreciate the experience that you and your team bring to the table. And of course, we have a local team that are committed and have gone through crises of one form or another, and therefore will bring their own local context to the combined effort. So we do look forward to that. I just wondered whether Dr. Dawkins Wright, who has been manning the emergency center here, may want to say a few words, and then we go quickly into questions.
Thank you, Minister. Hurricane Melissa targeted our country and blasted into Jamaica in the parish of St. Elizabeth. Then she lashed her way to exit and damaged quite a few bits. So needless to say, St. Elizabeth felt it in a way that is a lot more delicate than we can probably articulate as much as we would like to. Minister would have mentioned and provided the outline, some details, and that we're doing our restoration. We do know that in this state, whilst we can provide as much guidance, that some persons are more in survival mode than others. And so it may be difficult to comply with some of the guidance that we have given. And so we recognize that we need bolstering in a lot of areas. Two things that pose a threat. One, as we restore, especially in the parish of St. Elizabeth, because it's so delicate, extra reinforcement is required to ensure that whatever we put in does not collapse again. Also, what we're looking for in terms of what people providing for the public health measures will do, we have to watch out for those. Minister mentioned our food and what may happen. Minister mentioned the matter of water. Our role is to protect health. Our role is to provide health services. When those teams were in those facilities looking after those patients, and I speak and focus a little bit more on Black River, they held that building as much as they could and kept all of those persons until we could manage to do what we need to do. That is the team in health. That's what we're going to do. So as compromised as the system is, we haven't forgotten what we need to do. We are going to do what we need to do. And we are going to depend on that support that is coming in to ensure that this health system delivers what it needs to deliver. That's all I have to say, Minister.
Thank you very much. Thank you very much, Dr. Dawkins. Right. So, as I said earlier, there's a full team in the room, not on camera, but they're part of a much larger team that's behind these walls. The Emergency Operating Center is a 24-hour operation that keeps engaging and responding and coordinating across the country. There's also a very large team out in the country. I want to just pay tribute to the CEOs, the SMOs, the head of nursing, the auxiliary staff, the porters. I've seen many examples of heroic response. The porters taking staff members to visit their families to see if they can see what has happened to them, and because they have no other means of transport, no communication, that kind of thing. The staff at Falmouth Hospital outside with the big pots cooking because dietary was out of commission, and they literally had the stoves on the outside under the natural elements preparing meals for the patients. At SAV, the CEO being on the roof trying to, at great risk to himself, because I don't know him as a roofer, trying to repair a roof so that the elements doesn't further contaminate the equipment or the supplies. The operations person taking me to the fire station to borrow the Starlink to make a call. The JDF flying in, looking for a place to land, moving patients out in Black River, saving the lives of 4 or 5 persons who had to be airlifted to the university hospital. And I could go on and on and on. I mean, we have seen a lot of it. And, if there is anything positive that can come out of this, is that we are resilient people. We find ways to survive. We come together when it's necessary. And I think we're doing just that despite the challenges. But still a lot of work ahead. I just want to say to the public that from a health team perspective, we know what we need to do, and we're going to go out there and do it. It's not going to be perfect. There are going to be cases when we have to respond, when there will be complaints, there will be concerns. But we're here, we're listening, and we're going to spend as much time on the road to support those who are under pressure. And that involves our partners like PAHO and others who will come on board. So for now, we will continue this type of communication in the weeks to come. During COVID, we had a kind of COVID conversation. I don't want to call this Melissa conversation, but we will try to reach out and allow for an opportunity for comments, feedback, queries, and better coordination, because we think in crises, communication is absolutely critical. People need to know what's happening. And no matter if it's bad news or not so good news, I think it's important that people know. All right, so I'm open to questions now if there are any. Okay.
All right, so we're going to ask you just to state your full name, the media house that you're representing, and put your question to Minister.
Good morning. I am Camille Williams from Radio Jamaica / Television Jamaica. Minister and the other members of staff who are here, I visited Santa Cruz yesterday, and we tried to get to Black River, couldn't get there. But when we stopped in Santa Cruz off the main road, we went to the New River District, and we also spoke with the St. Elizabeth Infirmary. One of the issues that is present in New River, and I suppose other places, is the issue of persons who have died or dead animals. When we were trying to get into New River, animals had died and their bodies, decomposed bodies, are on the roads in water. And people have been walking and traversing in those waters. Do you have anything to say, advice, anything, any caution? Well, not just Minister, anyone else in the room. Do you have anything to say to persons who are in places where there are reports of dead bodies, whether in buildings or on the roads or dead animals? That's one question. And 2, do we have an idea now of the possible or current official death toll? Last number that we heard was 19. And I spoke with the funeral director, and he didn't want to go on record, but seems that there are far more out there than we can get to. So 1, death toll. 2, any advice regarding dead bodies?
Right. So I had mentioned the environmental health team, and the leads are in this room. You can speak to them after. But it's a very important part of the response, and that's the mode we're in now. Having secured some communication, having cleared some of the roadways, and now have the mobility to go into communities, we can now target particular areas while we work with the authorities, the other agencies, to secure other areas. So the team would be on the lookout for what you have just mentioned. So dead animals, for example, proper disposal of those carcasses. Clearly, if it's the worst of a dead body, then there is a mechanism for that. When I was in Westmoreland at the hospital, they were taking in a few bodies, and some of them were marooned in communities. So it took a little while to access them, and you wouldn't have known until someone raised the alarm that this was the case because of the nature of the accessibility and so on. Once access and notification was given, the JDF would provide the level of support that we can provide, air support, but then we also have arrangements with different entities to pick up and to drop off and so on. And I did witness at least 3 or so when I was at SAV. There were also persons who are injured. One man who broke his leg and was at home for like 3 days because he couldn't get access, and he came in while I was there. But the environmental health team, numbering 600 in an ideal scenario, would be out there, and we would want a kind of feedback on that if persons see, as you have just indicated. I don't know if anybody else wants to comment further on that, but that's my understanding of how it works, right? And we have to be vigilant, and it has to involve all of us, okay? I don't have any official numbers on deaths. I know that there was an announcement by, I think, the Minister of Information on the 19th. I would imagine it's more, but it wouldn't be wise for me to speculate because, and I say so because there are still places that we have had difficulties reaching. I know the storm entered the border of Westmoreland and St. Elizabeth. Communities like Darliston and those areas, Black River, of course, they were really impacted by the wind. A lot of roof damage, a lot of injuries, which we are now seeing coming in. We hope for the best, but we have to prepare, plan, and do the necessary reconnaissance to determine on that. So I'm sure the Minister of Information, once she gets an updated report from the police, will provide that information. Any other questions?
Last thing, and then I'll give, of course, some other colleagues. The field hospital that your team is looking to set up in Black River, has it already been set up? Where is it, and when would they open?
No, it's not yet set up, but we have identified a location. The team, the forward planning team are here. There's a small committee that Ian is a part of. Dr. Dawkins, right? I joined them last evening, had a discussion with them. That is planning the logistics of movement. There are discussions around air movement and or land movement, so containers, but there is also the possibility of air movement. We're getting some support from the U.S. Army and their large cargo helicopters. Some of those details will become more apparent in another few hours. So one way or the other, we're going to be moving the bulk cargo to the site, and there are 50 JDF soldiers who are on standby will be present on site tomorrow, where the cargo is expected, all other things being equal, to be dropped, well, not dropped, but placed, and from there the team will proceed to build out, which I am told will take 24 hours or
It's a significant undertaking. They will start probably travel tomorrow.
Yes.
And then I would expect they would spend the next days.
Next few days. So we do expect that hospital will be in place sometime this coming week. And that's good for that town and that area because it, as Ian said, it's fully equipped, operating theater and all. And the team that are with the JDF are experts on this. And once it's up and running, essentially we'll have a hospital in Black River to support the team there and some supporting staff to support the team. And the others will come during the course of the week into the next week. The Spanish one first this week, and some work is now being done to determine where we put that. Yes.
Okay. Good morning, everyone. Morning, Minister. In terms of the solidarity cleanup exercise tomorrow, there are many Jamaicans, including myself, maybe feeling a little bit of survivor's guilt, wanting to be a part of something. Is it open for persons to be able to join that effort? Tomorrow is Sunday, so many people don't have to go to work. Is it too late? Or if they can join, can you indicate how?
So in our planning discussion, we had taken a decision to use health staff and their family members initially. And let me tell you why. And it's not that we think we have an authority on compassion or even volunteerism. We were a little concerned about control and coordination in the first instance because we know a lot of people want to help. And what I don't want, and the team decided on this, having explored it, is for 500 people to end up at a hospital site and the control around who does what and maybe even put themselves in harm's way because there's a lot of debris, broken glass, zinc and cutting, trees that are falling down and that sort of thing. So we took a decision in the interest of doing something quickly to support the staff and to clean up the grounds, to use a control number, I think about 200 that we have confirmed. And then after that, we will manage further support. Now, I'm looking at Pitre, and I'm not even sure I have the details as to who is going to cook the lunch. Is it you, Pitre? We have some welfare packages. Maybe if persons have welfare packages and they want to drop off at a central point, because we intend to, this is for the staff now, because believe me, we really think the staff needs it, from the porter to the doctor, because they have lost everything. So we want to try and provide some initial welfare support. And our offices are here in New Kingston. So if persons have packages and they want to leave, maybe we could take those and just give it to them as a short-term thing. I know it's short notice. We are making some arrangement with Minister Charles. So it's a kind of moral support, a little welfare support, a little encouragement, and a little cleanup. It's everything in one, but trying to do it in a controlled way in the first instance. But there'll be a lot more opportunities of this kind later on.
Okay, I have another question. I know you said that there is a mental health specialist coming into the island on Monday, but just curious to know, is there any additional, are there any additional resources that have been put in place in terms of persons needing to call now? If you have, larger numbers of persons calling, do you have the resources?
So one of the things that we are planning to do, and I've already started to look at it, is to increase the capacity to support online. But we also need to expand the capacity on the ground, and ground zero, meaning those 5 parishes, because the communication function is very limited. So it's hard to communicate with the people in Westmoreland or them to communicate with us. You literally physically have to go to them, or at least have a central point where they can walk to. It was interesting. When I was in St. Elizabeth, I saw a person say they were walking from Westmoreland to come and check on their loved ones, and they were walking for hours because they had to walk over trees and so on, and there's no communication. I felt very inadequate when I was trying to reach some of the parishes and just couldn't reach anyone. So we are going to have to put in place and are putting in place a communication mechanism that is more community-based communication, which is why we need teams on the ground in the communities because of the challenge of the phone. But we will also increase the phone lines.
Thank you so much, Minister. So I am Dr. Jubilee Brown Service. I'm the first Vice President for the Jamaica Medical Doctors Association, not from the media. And I'm also a senior resident in the Department of Psychiatry at the university. So I'm very heartened to hear your focus on the psychosocial, because we do see the mounting psychological stress with our members. We represent 2,000 plus doctors. Many of them are in these disaster-stricken areas that you've mentioned. So we thank you right now. Our president and other team members are on the ground in Black River trying to support our members there. So we thank you for that. And I also thank you for the very comprehensive brief. You answered some of my questions. So the only question I have today, Minister or whoever, is there any plan to redeploy any doctors from the other areas to these areas? That's a question we've been getting from our members on the ground. And just to highlight that I do know the ministry has been calling for volunteers. We have members that would love to volunteer, but because they're in their post, they can't move. And so we'd like some guidance on that. Thank you.
So I'm going to leave that to the clinical team, but I would think that logic would suggest that, yes, there will be a need for some capacity support in those communities. We're going to have to do a couple of things, though. We have to ensure that the people who may be relocated, even if temporary, have somewhere to stay, for example, because one of the challenges we have, even with the persons coming in from abroad, the volunteers, the first thing they ask is, and even though they don't need luxury stay, it could be very modest, but they still need somewhere that is secure where they can stay. And I've asked the team to look at that. Isn't that what Dr. Dawkins, right? You want to comment on that?
Sure. So thank you very much for that. And yes, it is. We are, in fact, working on the plan as it relates to how we can bolster the human resources and leverage what we have. We're still working out some finer details, but as soon as that is refined, we'll let all persons know, including our local team here is offering. If you go ahead, sir. Sorry.
But let me say that we're going to need a lot of volunteers, and different persons will offer different capacity. What I'm hoping to do this week is to put a mechanism in place at the level of the parishes, the 5 affected parishes.
Yes, sir.
So when we streamline and say we have 5 doctors who are primary care doctors who may want to work at a health center to relieve the doctor who lost their house and need to go and sort out their personal life, then we know that the parish team is able to say, okay, go down to Darliston or go up to wherever. And it's very coordinated. By then, the road will be opened up to access those communities. There's still work now going on to go into Westmoreland from St. Elizabeth. So I am hoping that this week we will sort that out, yes, where each parish will have a point person, and then we can direct someone who may just want to go and give out 100 bags of stuff. That point person will say, boy, go into that community, and this is the person you talk to there, type of thing. That's the kind of coordination that we need, and we don't want to refuse anybody, but we just want to make sure that they're adding value to the process, as opposed to either being confused themselves or putting themselves in harm's way. And we need to manage that. But I appreciate the offer from the association, because I think you carry a kind of capacity that's going to be very important. So we need to have a conversation. Maybe we need to meet early week. So you just follow up in my office and let us have a discussion. Any other question?
Good morning. Good morning, everyone. Russia Williams from JIS. This is with respect to food. I understand that PAHO will be, of course, donating some supplies. Just wanted to get a feel of what that includes, particularly as it relates to food, because there's food scarcity in that part of the island.
Well, you want to speak to what you have, and then I'll speak to the food, because I'm sure yours doesn't include food.
Thank you very much. Very nice to have a question, Ms. Williams. The Pan American Health Organization, the World Health Organization, focuses its efforts specifically in the health sector. And while food and nutrition is, of course, an essential component of health, Our focus is actually on emergency medicines, the emergency components of the health infrastructure, water and sanitation, the practical aspects of making sure that a health center can come back up to be able to serve the public, whether it's actually tarpaulins or these types of things that are the practical things that help the health services come back up. The whole food support from the international community is largely coordinated through the World Food Program, and they have a whole system underway as well in the country unfolding.
Okay, so generally speaking, there are different agencies. Remember, we're joint up government, so the Ministry of Labor, ADPEM, local government, they are the primary ones responsible for coordination of food relief. And they are very active on the ground. I know Minister Charles and Mackenzie are now in Sablamar as we speak, doing some of that. And they have teams in St. Elizabeth and other places. So food provisions are handled slightly differently. Our cleanup tomorrow, and any welfare support we're giving is really to our staff, because of the challenges that they face. But the general approach to food provisions are done through local government and Ministry of Labor. What I will say, though, is that as the roads open up, and that is being done as a priority, both things like food, petrol, and so on will become more available in those communities. The big challenge has been the logistics of getting it there, because Jamaica isn't short of food. In the trade, it's really the distribution of the food. And clearly in those parishes, because of the disruption of the trade from damaged buildings as well as road movement, then there will be a scarcity. But I do hope, based on the efforts of the government, that over the next couple of days into the new week, that access would allow that some relief in that area. It doesn't mean that people won't need help, because a lot of people have lost everything, and therefore the disposable income would be a challenge. So the government I think would be even in a better position to deliver because of access. Any other question?
I have another question, Minister. So we have been inundated at the JIS with requests for information about persons wanting to volunteer their medical services from overseas. Can you just indicate here what the process is?
Right. So the team there's a vetting team. Persons have expressed an interest. Some have come to me, others to other persons. I normally hand them over to a team. It's a small committee. Dr. Dawkins Wright is part of that team. There's a process involving people's credentials, so we appreciate support, but we want to make sure that persons are qualified to provide the level of support that they're offering. We will fast track that, and have been. So it involves sometimes the nursing council, medical council, but Dr. Dawkins Wright is able to move those quickly. So if you have to get a temporary permit of some kind. So if you get those inquiries, you pass them on, maybe to Dr. Dawkins Wright, and she will do some follow-up checks, and we have a team that's working on that. And then also, having gotten the credentials sorted out, we have to direct them in the right place. So as I said, I met with 2 groups yesterday, and there are other groups that are here that we're talking to also. Yes?
All right, Shanique Thomas here from JIS. I'm asking this question on behalf of the persons on the live. Now, the question is, for persons who are in the marooned areas, what provisions are being made to get food to them? The minister would have Minister Dana Morrison-Dixon would have mentioned earlier this week about airdropping food. Has that started as yet?
I cannot comment on that. I would have to find out. What I'll say, though, is that my own efforts in health, where persons are marooned in a community, we seek and receive the support from the JDF because of the airlift, and they would normally go in and help. And I know they're doing it in other areas. But I also know that the NWA, through Minister Morgan's leadership and oversight, is clearing the roadways to access the major towns. There's still some work to be done on the off-roads, and I suspect that's where most of the challenges are. but some of that is also happening. So I can't comment on the specifics, but I know that the JDF would be the kind of primary drivers of the search and rescue or support for those communities.
Okay, thank you. And another question is, what provisions are being made to ensure that the distribution which is happening isn't just happening for one community or just one set of persons?
Yeah, I appreciate that question, but this is a government with a lot of compassion and understanding and recognizes its role to serve all the people as a government. The Prime Minister is very clear, both privately in cabinet meetings as well as publicly, that this distribution effort, this supporting effort, is for every single Jamaican that needs it, not for any particular Jamaican. And certainly I will say in health, as a Minister of Health, I've never and we will never discriminate as it relates to lives. And saving lives and the health and wellness of individuals discriminate in favor of or against anyone. So the short answer to your question is that we're serving everyone. I don't ask anybody who they are, where they come from. When I see them turn up at the hospital, if they need help, they need help. And that's the approach that we will take right through this process and beyond.
Okay, last one. This person is asking if you have any updates in regards to Lacovia Primary and Junior High, which was being used as a shelter with a lot of elderly persons there who aren't well right now.
The shelters are manned through the Ministry of Local Government. I'm sure they have an update on that if persons are in the shelter. I have a few in my constituency. We didn't get much damage, some but not much. And to the extent that persons went to those shelters, the Ministry of Labour and Local Government would normally provide support in those. Health does too, based on request. If we weren't requested, then chances are we probably would not have been needed in those shelters.
And health does a check.
Huh?
Health visits to the shelters.
But we visit the shelters also to check on them.
Okay, thank you.
Okay, any final question? I have to go now, unfortunately, sorry. No. I want to thank all of you for coming. Thank you. Sorry about this very long-winded brief, but this is the first major brief that we're provided. I just want to reassure everyone that we understand the task at hand. We're collaborating with PAHO and others. The team is on the ground, and we're now focused on the solutions. So we're not mentioning any challenge without offering some solution. And that's, I think, where we need to be now. And I think we have seen enough to know exactly how we need to approach the solution. So God bless and keep safe. And I agree, to the extent that you can offer a helping hand, please do. There are Jamaicans who need it far more than you, and no matter how challenging you think your circumstances are at this point. Thank you very much. All right. Yeah.
Giraffes live in small, stable family groups. The strongest bond is between a mother and her calves. Able to stand mere hours after they're born, young giraffes are reliant on their mother for the first 6 to 8 months. Within 10 hours of being born, calves can run at full speed. But they never leave their mother's side for long. Reliant on her milk to keep them healthy and strong. After 8 months, calves can begin to eat solid foods and start sparring with their friends. Giraffes press their necks against one another, sometimes as a show of affection. But for most, it is to assess an opponent's strength and weight in competitions for dominance. These altercations can be aggressive when battling over a mate, often ending in injury as they throw their nearly 2,000 kilograms of weight into one another. A mother may also show aggression when protecting her calves, but on the whole, they use their camouflage to avoid threats, protecting themselves from danger amongst the shrubs and trees of Africa's grasslands. In the depths of the world's oceans, dwelling in coral reefs, all three are members of the same class. Masters of camouflage. They are the fastest and most effective assassins in the sea. They can change color in the blink of an eye. Cephalopods. On Earth for over 500 million years, cuttlefish, octopus, and squid are all members of the cephalopod class. All three use camouflage with lethal efficiency. Octopuses are 8-limbed mollusks with over 300 species. Cuttlefish, armed with a unique internal bone called the cuttlebone. And squid, equipped with 10 limbs, an elongated body, and large eyes. Marine animals armed with tentacles and an unrivaled ability to remain unseen. Cephalopods are found in the ocean's shallow waters to its dark, murky depths. These ancient creatures are underwater soldiers, equipped with an armory of unique weapons. No creature on Earth can change its camouflage as effectively as cephalopods. Masters of speed, they can change color in 1/5 of a second, their brains signaling their specialized skin to adapt swiftly. They are highly skilled creatures. At home in the world's waters, they are carnivorous predators, feasting on all manner of fish and crustaceans that inhabit the Earth's oceans. Seemingly docile, they are in fact expert hunters. The art of camouflage, their biggest asset. All three are masters of camouflage, armed with the deadliest weapons in the sea. scanning coral reefs and the seafloor, this octopus is on the hunt, becoming one with its surroundings. Adapting seamlessly to its environment